So now I call on stage Tune Insight, please.
So thanks for the introduction. Thanks for inviting us to present in this venue. So I'm Juan Troncoso, the CEO and co-founder of Tune Insight. And our company is focused on enabling data collaborations in settings that were not possible at all before. I mean, this morning you have heard many times about the problems of exporting and extracting data or engaging into data-driven analysis that can actually extract the value of this data. But the problem comes when you try to get access to this data and find this data. And this is why the combination of technologies that we apply at Tune Insight and the platform that we have deployed already at all Swiss university hospitals comes to solve these issues and enabling a trustworthy environment where data stays where it is collected, stays at the data controller, and is never transferred or shared or moved or disclosed to any other entity in the network. So this is the way in which we can actually extract actionable insights that can power the AI, ML, all these decision, prediction, prevention systems that we have heard of during the morning, and we can also enabling valorization of these insights extracted from the data without valorizing the data itself, which sometimes is raw, in raw state that is not actually usable, but from the insights generated from this data. And this is what can actually streamline compliance and accelerate this access to results that is typically needed in clinical research, but also in collaborations across the whole industry in healthcare. And this involves not only multi-site analysis across hospitals, but also relation between hospitals and pharma for clinical trials, retrospective analysis, control branch, securing and controlling what are the results and certifying that these results are correct and come from a sufficient and representative source of data pooled across multiple sources, even if they are siloed, and also collaborations between hospitals and insurers to enable the models such as value-based healthcare that we have heard before, and we will hear more about probably this later this morning. And in this setting, we are covering the whole life cycle of the data. So we are applying technologies such as the ones we heard before, homomorphic encryption. We also apply multi-party computation, differential privacy, federated analytics, and federated learning. But we apply a combination of technologies that can actually make this solution scalable, practical, and useful in many different settings, covering the whole space of the data lifecycle in healthcare. Going from finding the data with a data catalog solution that can explore data from multiple sources in an interoperable way with common standards and common ontologies, a sandboxing environment where you can actually look into a representative sample of this data that is not the original data, but is a synthesized version of the data that preserves privacy and enables access to this sample without tapping or touching into the original data, and full analysis on this data, enabling the power of AI, machine learning, training these systems from multiple data sources without exporting or moving this data. And finally, giving back also governance and control to the hospitals and clinical sites that host this data and are responsible for avoiding leakages and preventing breaches from this whole data to guarantee compliance. We are the technology partner of the Swiss Personalized Health Network, deployed at all Swiss university hospitals, powering the distributed exploration and analysis system that will be extended also next year to cantonal hospitals and covers already a population of 600,000 patients in Switzerland during this year. So this solution is fully linked with the data warehouses at each of these university hospitals, enabling feasibility analysis in a streamlined way, so within seconds for authorized users of the system, instead of waiting for months for an ethics approval to get access to these kind of results, and enables also federated analytics, getting and extracting insights from the data, again, without transferring or risking this data, with the purpose of streamlining access to results and speeding up the progress of research and analysis on this data. I don't know why this is. Okay. So in summary, what we're enabling is giving back control and governance with a full control and access rights establishment and policy control at each of the different clinical sites that are the controllers of the clinical data, the real world data, whereas we streamline compliance. So we are certified ISO 27001, but we have also all the mappings between the technology and the data protection regulations, such as the GDPR or the Federal Act on Data Protection in Switzerland, mapping all this technology to each of the principles of these kind of regulations of minimizing data, minimizing risks, privacy by design, security by design, streamlining compliance from the technology side for any of these systems dealing with health data. And we reduce the time to get access to value, to the insights extracted from this data, enabling, again, pharma clinical trials, but also value-based healthcare settings with insurers, and preparing for the future of ML AI by enabling this kind of federated and quantum-safe computing on this federated pool of data. This is a technology that has been developed explicitly for healthcare applications, in which me, myself, have been working since 2005 in application for genomic signals. That is data that cannot be anonymized and is very difficult to share. And that has been, again, applied in the Swiss landscape since 2015, and now being extended to other European countries, including France, Belgium, Spain, Portugal, Finland, and UK. So thanks for your attention. If you have any questions, I will be in the booth later this morning.